Did you try telehealth services during the pandemic and not stick with it because it's too tough? Let's talk about that a little bit more. I'm Dr. Jentz, Chief Medical Officer of Deya and an optometrist.
I'm Dr. Jovi Boparai. I am the CEO of Deya and an ophthalmologist.
Telehealth care has been delivered in all kinds of different ways. And as we all know, we get, as patients, sometimes the opportunity to do video visits around a whole host of things that our PCPs provide us, but they're not very personal bits of care. And in the eye care realm, remote eye exams have not necessarily grown broadly since the pandemic. In fact, they've dropped off a bit. There's got to be a new way to do tele eye care, don't you think?
I completely agree. When I used tele-eye health through video visits during the pandemic and shortly thereafter, it just didn't fit in my clinical schedule. It was impossible for me to see patients in the clinic, then break away, do some video visits. And I tried that and it didn't work. And then I tried to do video visits after my clinic, but then I found myself staying in clinic until 6, 7, and it just wasn't ideal in my schedule.
We're providing the patients an opportunity to receive care from their eye doctor through their smartphone. Tell us a little bit more about it.
Absolutely. The main pain point that I had when I used conventional and traditional telehealth platforms was the need for the video visit, where I had to always jump on, see the patient face to face, make an assessment, have that conversation. What differentiates Deya from these conventional methods is the power of using asynchronous communication. We believe that data can be collected, analyzed, presented to the eye doctor in an asynchronous fashion, allowing the eye doctor to render great care when it's clinically appropriate, while supporting the patient remotely through their eye care journey. And what this allows the eye doctor to do is to provide the care when it fits into their schedule.
And our patients as eye doctors want to see us. And Deya provides that opportunity, and it keeps them from perhaps looking elsewhere for care that they might seek on an urgent care basis, or having more questions than they have answers. They might go to somebody else or a different resource. But with Deya, they have the opportunity to continue that trusting relationship with their eye doctor.
Absolutely. And if you're interested in learning about Deya, check us out on deya.health.